Hello and welcome to today's video. Today we're going to discuss advanced gum disease, which affects a significant proportion of the population. So let's get straight into the video. There are two main types of gum disease. One is gingivitis and the other one is periodontitis. Gingivitis is a milder form which is reversible. Periodontitis is much more destructive and causes irreversible damage to the supporting tissues and the bone. So this can also lead to tooth loss as well. Let's look at the different signs of periodontitis. Number one is bleeding gums. Normal healthy gums do not bleed. So if your gums are bleeding while brushing or bleeding spontaneously, or when you wake up in the morning if you see blood on the pillow, then there's every chance that you suffer from gum disease. Number two is swollen and painful gums. So if your gums are inflamed, red, swollen, or if they're very painful or tender to touch, then make sure you seek help. Number three is your teeth might appear longer. So if you lose the supporting tissue around your teeth, then your teeth will appear longer. Number four is bad breath. Frequent bad breath or persistent bad breath could also indicate gum disease. Number five is mobile teeth. Due to loss of bone structure around your tooth, your teeth can become slightly mobile or loose. And this can also lead to point number six, which is tooth loss. Number seven is sensitivity. Now, when you have gum disease, you could also suffer from recession. So your gums shrink, exposing more root surface. So the root of the tooth is quite sensitive. So when the root is exposed, you can experience quite a lot of sensitivity. Point number 8 is abscesses. So you could have bacterial infection or buildup of pus in the gum. And if that is the case, you will require antibiotics as part of the treatment. Let's look at the risk factors for gum disease. Number one is dental plaque. So if your oral hygiene is poor and you allow dental plaque to accumulate above and below the gum line, then the bacteria in the dental plaque will start affecting the supporting structures around the tooth. You may also end up with dental caries, but apart from that, the gums will start to be affected and eventually it will also affect the bone. And that will lead to advanced gum disease, which is irreversible. Next major risk factor is smoking. Now, smoking increases bone loss. It also impairs tissue healing. Now, in a smoker, there is decreased blood supply to the gums. Because of this, there is reduced amount of nutrients and reduced amount of growth stimulants that the gums receive. So the gums are not able to repair themselves like we need it to. So if you continue to smoke while you're having gum therapy or periodontal treatment, then this reduces the favorable outcome of therapy. Next risk factor affects only a small proportion of the population. Now, some people have a certain gene variant that makes them more susceptible to disease, and this may be seen in certain families. Now, in such cases, if there is poor oral hygiene, it very quickly accelerates into advanced gum disease. The next risk factor is poor diet. Now, if you suffer from nutritional deficiencies such as calcium deficiency or vitamin D deficiency, this could definitely affect your bones. And if you're anemic or if you have iron deficiency, it can affect your gums and the other supporting tissues around your teeth. Diabetes is another major risk factor for gum disease, in particular uncontrolled diabetes. Now, this is because the defense mechanism is reduced or compromised, and because of this, there's increased susceptibility to infections and disease. In diabetics, there's decreased collagen synthesis and there's increased breakdown of collagen. So thus the tissues around the tooth are much more susceptible to destruction than normal tissues. The next risk factor is stress, and this is becoming increasingly common. Now, in particular, we're looking at long-term or chronic stress. Now, stress could be anything. It could be financial stress, exam stress, just the feeling of helplessness or not comfortable with one's appearance or being body conscious, etc. Now, when one is stressed, there can be change in daily habits such as poor oral hygiene, grinding one's teeth or clenching. There can also be decrease in salivary flow and hormonal fluctuations, which could lead to immunosuppression. That means reduced immunity. Certain medical conditions can also be risk factors, conditions such as arthritis or dementia. So these affect one's ability to carry out oral hygiene effectively. So a person with arthritis might not be able to brush effectively. So this can act as a contributing factor and can aggravate existing gum disease or may cause gum disease. So let's look at the various treatment options that are available for those with advanced gum disease. Number 1 is periodontal therapy, which includes deep scaling and root surface debridement. So basically your dentist would clean out your teeth thoroughly, and this will be above the gum line as well as below the gum line. Number 2 is laser assisted periodontal treatment or laser therapy. Now this is a patient friendly, minimally invasive procedure. So a small laser fiber, which is only the width of 3 human hairs, is inserted between the gum tissue and the tooth, and this painlessly removes all the toxic elements that causes gum disease. The main advantage of lasers are that lasers are bactericidal. That means they kill bacteria and they encourage tissue growth. So they encourage your own tissues to heal and repair itself. The next option is referral to a gum specialist. Now, certain advanced cases where you need surgery or you need advanced procedures, your dentist may refer you to a specialist. Now, the other treatment option is also to remove teeth with hopeless prognosis. So, if you've got really loose teeth or really mobile teeth, then those teeth will unfortunately have to come out. Now, it's very important for your teeth to be monitored every 3 monthly till they're stabilized. So initially you will be seeing your dentist quite frequently, but after that, once your gums are stable, then it will slowly shift to 6 monthly appointment. What to expect post-treatment? So after treatment, you could expect a bit of sensitivity as the root surface of your teeth might be exposed. Now, the roots can be quite sensitive. That is because they do not have a thick layer of enamel to cover them. There could also be increased susceptibility to root caries or decay. So there can be temporary increase in tooth mobility. Teeth may appear elongated or longer, and you will also notice certain dark triangles or spaces between teeth. Periodontitis is a condition that slowly destroys the bone that holds your teeth in the jaw, and unless it is treated, the end result is that the teeth become loose and are eventually lost. So any treatment that is done will not work unless it is supported with thorough plaque removal at home. So your plaque score should ideally be below 20%, and your gum bleeding score should be below 10%. So every time you visit your dentist will take certain measurements and make sure that your plaque score is below 20%. So here are a few things that you must do religiously at home every single day. Make sure you're brushing twice daily using a fluoridated toothpaste. As you're at an increased risk for root caries, make sure that you have at least 1500 parts per million fluoride in your toothpaste. Make sure you clean between your teeth using interdental brushes, and you get different sized interdental brushes. Your dentist may help you choose the right size. So if you've got a larger space between your teeth, you can use a larger brush, and if the contacts between your teeth are smaller, then you go in for a fine interdental brush. Try and use a mouthwash regularly. Now, sometimes your dentist might prescribe a chlorhexidine mouthwash. These are mouthwashes that are available in black bottles. Now, if you're using such a mouthwash, make sure that you do not use it immediately after toothbrushing. This can react with your toothpaste and can cause staining of the teeth. And also try and use it for a maximum of 10 days at a stretch. Then stop for a while, stop for another 10 days, use just a daily mouthwash, and then you can go back to your medicated mouthwash. If you use this particular mouthwash, the chlorhexidine mouthwash, for extended periods of time, then it can stain your teeth. Also, if you're smoking, then this is the best time to stop smoking. If you're in for periodontal therapy, make sure that you're on the smoking cessation program as well. And if you're diabetic, make sure your diabetes is well managed and is under control. The last and the most important point is to minimize stress. I know it's easy for me to say, but stress can create a lot of havoc. So try and find better coping strategies. Try to forgive and forget and minimize stress so that you respond to periodontal therapy much better. Hope you found this video useful. Do share it with your family and friends. And if you want more such content, make sure that you subscribe to this channel.